Now, our next presentation, So Rare, So Care, helping rare disease patients and families to live a better quality of life by Dr. Huy Do. Dr. Huy Do is CEO and co-founder of the Vietnamese Organization for Rare Diseases. Established in 2021, VORD is a patient support and social enterprise group which promotes research, diagnosis, and treatment for people with rare diseases by providing education, advocacy, and patient services in urban, semi-urban, and rural communities.
Okay, I'm Huy Do and I'm founder of Vietnamese Organization for Rare Disease, and we are a social enterprise non-profit, and we just established in 2021. In our board of director, we have at least 50% is patients, but right now we have 100% in board of director as patients caregiver. After nearly 2 years, we become official member of Asia Pacific Alliance of Rare Disease Organization, Rare Disease Day, and also Human Genome Organization. Our vision and our missions that we want to collaborate with local and international organizations. We believe that we can bring the better outcome for Vietnamese people who are living with rare disease through the education program, advocacy program, and also patient services. We base everything. We have 5 targets, and our target is based on 10 things very rare in rare disease established by IFRA of Japan. And our target is about raise awareness about the rare disease, about the living of patients with rare disease. We also have the patient and medical doctor to understand about how to diagnosis, how to treatment, and how the rare disease can be prognosis. Besides that, we also collaborate with the patients group to help them to build, to strengthen their community. And we also have our government to shaping the policy for patients with rare disease, because until now in Vietnam we do not have an official definition of which disease is rare disease. And the final, that is, we want to collaborate with global, and we want to connect local with global to establish a bridge for the patients in Vietnam and patients in the international. This is about our team. We also have a medical team in our organization to help the patients to understand about the disease. We also have a patient advocacy team, and this is led by our co-founder. That is patients with osteogenesis imperfecta. And we also have tried to build a platform to help the patients to understand more about their disease. This is our 3 pillars. We have 3 pillars. The first is about our main organization. This will help the patients understand about the medical, help the patients to connect with the legal team to help them to achieve the benefit from the government. The second, that is Care for Rare project. Right now, it changed the name to So Rare, So Care. So it will help the patients to understand, to gain the experience for education, for working, for access with medical equipment. And finally, that is about VORD Academy. We understand that the knowledge about the disease, about the living with rare disease is really hard for caregiver, for family. So through the VORD Academy, we will help the patients to understand about the disease, understand about how we can choose the right, such as the right wheelchair, or how the patients can facing with the rare disease in every day of their life. This is about for academy. We also have the patient to understand about the genetic testing, about the living with the rare disease. This is about we collaborate with the cerebral palsy community in Vietnam, and this is we collaborate with medical doctor. We also have our website. In that website, the patients can understand about journal the journey of the patients who are living with rare disease, but day by day through the story of a lot of patients. We also have the project to help the patients to access the free wheelchair, the free medical equipment such as ventilator bank. And this is our team when we go to the Rare Cancer Initiative of Australia to join to have to establish our project. But after we have the pricing project until now pending due to we have some struggle with the policy in Vietnam because medical equipment is wheelchair. Wheelchair is a type of medical equipment, so it's really hard for us to register with the government. But despite of the project is pending, but we try to help the patients to access the free wheelchair ventilator, such as this. This is my bike, and I'm using it to transport the own wheelchair to the factory to repair it, and after it repair with good quality, I bring it to the patients. After nearly 2 years, we have some achievement. That is, the first is we established the first rare disease day. It is registered in the rare disease day.org. This is have the meaning with rare disease community in Vietnam. That is before of this rare disease, the rare disease community not registered in Vietnam, and they don't understand about what is the rare disease, and they just thinking that rare disease is due to the family living not good enough, so the baby facing with that disease. So after with these days, we can have the patient to transfer the knowledge to the patients, and have the patient to raise the voice of the patients to the government, to the medical staff, and also to the society, so they can have them, they can understand more about us. We also, until now, we support three main organizations, three main groups. That is about Duchenne muscular dystrophy in Vietnam, spinal muscular atrophy in Vietnam, and also with the osteogenesis imperfecta in Vietnam. For example, we have 200 patients in SMA community and 500 patients with Duchenne. We also established some classes for the patients to understand about the disease, understand about the rehabilitation for the patients, so they can understand if they have the disease, if they don't have drug, they also need to do the rehabilitation, physical therapy every day. We also contact with other hospitals, such as this hospital in China, to have the patients to reach with the expert in the rehabilitation and also for the ventilation for the patients.
Dr. Haidu, you have a couple of minutes more.
Yes, okay. And we have a story about the patient with SMA. That is a sister of the family who have two patients with the SMA and epilepsy progressive disease. And she have taken about 8 years for them to reach her diagnosis. And after that, after 2 years, she's really hard to choose with the society, because you can see in the image, she has to reach the wheelchair. So I try to help her to access the first in her life. But as you see, because in Vietnam we don't have enough the rehabilitation experts, so you see this is this wheelchair is so big with the patients, but we cannot find the suitable wheelchair for her until now, because it's not available in Vietnam. So it's really hard for us to reach the essential medical equipment. Besides that, we also established the application, so the patient with SMA can understand about the SMA, about the supporting of the government, of the society to the patients, and also hearing about the story telling by the patients with SMA. And finally, we are a new organization, but we are official, the first and official organization in Vietnam. We really need the helping from the international, especially in medical equipment. and we're willing to sharing with other what we understand, what we know about the rare disease, especially the experience in SMA, Duchenne, osteogenesis imperfecta. And thank you everyone for listening for me. Thank you.
Thank you, Dr. Haidu. And the key message takeaway is communities and influencing policies, and also to look at living and growing, which is directly linked to care and support services. So, which is the key takeaway from your presentation, so that it gives, talks about the possibilities in life. Thank you so much.